I'm Dr. Dariush Saeedi. I'm a GP at the Spa Surgery in Harrogate. Today I'd like to talk a bit about feedback. I'm the lead for our fifth year medical students at the practice here, and one of the areas that we really try and work hard on is giving relevant and useful feedback back to the student doctors. Traditionally, feedback's been a fairly poorly rated area for student doctors and medical students throughout the years, and there's lots of different reasons for that. What we try and do on our placements is really get in early with the students and try and establish so not only their core learning needs, but also at least 3 learning needs that they have, which might be interest areas or areas to try and engage them more with the placement. So for example, this could be medical students who are interested in the management side of general practice or prescribing. And then what we would try and do is have a plan that we can roll out and really signpost them to the right place and the right people to enable them to then go and address those learning needs and get those skills they require from that. So this may be, for example, putting them in touch with a specialist clinical service. It may be in getting them in touch with our clinical pharmacist in-house and having a session with them, or perhaps it would be spending time with our practice manager and going through certain specific aspects of general practice management. What we try and do is, once we've established their learning needs and then moved on to a plan on how we're going to tackle those, throughout the placement at regular intervals we revisit those learning needs and try and assess how that's going, and really try and support them and point them in the right direction if they're struggling to meet those needs. At the end of the placement, what we try and do is tie together the things they've done to meet those learning needs. And some of it is about signposting. It's about saying, well, actually, yes, you have done really well with this. You've gone the extra mile. You've looked at developing this skill or improving your knowledge in this area. And I think it's almost closing the loop for them, and that often is really helpful. So it's kind of aiding reflection. But we also look at feedback in the sort of more traditional Pendleton type model, and we try and get a feedback from all the clinical staff that they work with, and also the non-clinical staff. So if they've been involved with various doctors throughout the placement, we try and get feedback from those doctors, again in the type of format where we look at what they've done well, what perhaps they could do differently or look to improve upon, and general comments as well. And that in conjunction with trying to meet their learning needs that they've come up with themselves, gives quite useful feedback at the end of placement for students. The feedback we've had from them has been really excellent. So they really value that extra bit of effort to signpost, to help them reflect, and to try and get them address those areas that they feel are important. We treat our final year student doctors like adult learners. We expect them to take some initiative, but we're there to facilitate, we're there to support them. And I'm very mindful that in placements in secondary care and in primary care, time is very much a scarce resource, but actually doing this doesn't take much time, and through the development of a simple template, you can actually have a very powerful feedback tool which the students really value.